It really felt like the universe sent me on this mission. I had severe cystic acne for almost 10 years and experienced both how debilitating it was to struggle with it and how much it occupied my mind space, but also encountered pretty much every access issue that you can think of trying to get it treated. Acquisition was really expensive. And then we were like, let's try one other state. We added Florida and our business doubled overnight. And I'm like, there's something interesting here. And we shifted strategies to get as many states as possible, as quickly as possible. And it's really been transformational for the business. We found really good success in ROI working with smaller influencers that just have real authentic stories to tell, having them post that, get the organic traction from that, and then boost those with Spark ads or use clips of that as part of content that we make for Meta and for TikTok.
Welcome to Subversive, a podcast dedicated to sharing stories from the best consumer subscription apps in the world. We'll bring you lessons for how to grow your consumer subscription business, including insights and inflection points that led to exponential growth from leaders at category-defining companies and innovative startups. Let's get into the show. My guest today is David Fuderan, co-founder and CEO of an online skin health platform called Honeydew that helps people struggling with acne and other skin conditions get access to effective skin treatments and expert guidance from licensed dermatologists. In this episode, I talked to David about how his personal decade-long struggle with acne inspired him to start Honeydew, about how the company is democratizing access to Accutane and other life-changing skin treatments, and about how he expects AI to change the world of online telehealth in the coming years. All right, welcome, David, to the Subversive podcast. I'm super excited to have you on today to talk about Honeydew, which is taking telehealth to the skincare and acne space. And would love to start by just hearing a little bit more about your personal journey. I know you've personally gone through your own ups and downs with acne and other skincare issues over the years. So let's start there, and then we'll get to the origin story behind Honeydew.
Sure. So I grew up in New York. My parents were Soviet Jewish immigrants who left searching for a better life. They became doctors in America. And so I spent my whole life around healthcare. I spent my summers working in their offices and have always been very conscious of the opportunity I have in life as a result of their decision, making sure not to take that for granted. And my parents always making sure to remind me not to take that for granted. I lost my father pretty early on when I was 16, and it sent me on this journey of much earlier in my life than I think most people get to, thinking about very consciously, what's important to me, how do I want to spend my time, and this opportunity that I have. Spent a lot of time deeply reflecting about this at 16 years old. My sisters would literally check in and ask me what I'm up to, and I would just say, I'm thinking. And in the end, it just kept coming back to me how much I love helping people, even on an individual level, but that I know I could do this on a massive scale, and that felt like a great, fulfilling challenge. So that kind of became my North Star. Didn't really know what that would look like. I did have a sense it'd be in healthcare because that's kind of what I'd been around all my life and have been very interested in that problem space and just masochistic enough to want to take it on. And I also think that's where you can have a really big impact in people's life. But I didn't know that I would be starting Honeydew or in skincare. So happy to chat about how we got there.
Yeah, well, I love that first part of the story, which is you have these two parents who are first generation immigrants. And so you felt the need to live up to their example and to make the most of the opportunities they afforded you. And they were both doctors. And so you spent a lot of time in and around the healthcare space. But then you've also gone on record about your own struggles, personal struggles with acne and the impact that had on you as a teenager and a young adult. So how did that factor into the Honeydew story?
Yeah, pretty much is the whole story because I never expected to start a dermatology or skincare business and know as much as I do about skincare as I do today.
Mm-hmm.
It really felt like the universe kind of sent me on this mission. I had severe cystic acne for almost 10 years and experienced both how debilitating it was to struggle with it and how much it occupied my mind space, but also encountered pretty much every access issue that you can think of trying to get it treated, which felt really frustrating because I was in New York, which has more derms than almost anywhere else in the country, and had grown up in a family of physicians. So, if I can't get access to derm care, I just couldn't imagine what the rest of the world was going through. And really lived this problem, but still probably wouldn't have necessarily thought of starting this business had it not been for my co-founder, who, if you ask him, he actually thinks he pitched me on this business, which kind of just like goes to show how meant to be it was. But I started this company with the dermatologist I was seeing in person who treated and cleared my skin, which was totally unplanned for. But we just like got to talking in an appointment, built off of each other's energy, and like have not looked back, and have been building together now for 3.5 years. And so that was a huge part of where I was like, all right, I've just got like one of the most nationally respected dermatologists in the world to do this with me, and this feels like really solvable because it's not a science problem; it's a logistics and access problem. And so yeah, we just and COVID happened, so everybody started using telemedicine. So we're like, yeah, there's something real here.
Yeah, I mean, every once in a while, I've had those moments too in my life where it just feels like the universe is trying to tell you something, and it sounds like for you, there were several steps along the way that brought
Yes.
you to Honeydew. And so, maybe last thing before we get into the journey of Honeydew as a company, tell me a little bit more about your co-founder. What's your co-founder's name? What's his background? I know he's a reputable dermatologist, and then what role does he play in the company's day-to-day operations?
Yeah, he is a Princeton, Columbia trained, board certified dermatologist. He's got a textbook that's taught in every dermatology residency in the country. I like to joke that he's like a Z-list celebrity. When we go to like these derm conferences, the residents are all like running up to take selfies with him. And he's just a great person, like amazing energy, very entrepreneurial, and very clinically, brilliant, great at diagnosing and treating. Um, and that's super important for me because I never really wanted to start a skincare company, but I did want to solve this problem of acne. And so my goal wasn't like, what's the lowest friction way I can start a skincare company? It's like, what's the best way I can actually solve acne? And like having deep clinical expertise at the core is so essential. Like this isn't like a medical advisor who's like there in face and name only. This is somebody who's like a 50-50 co-founder with me, who's like part of our team day in and day out. It's been great. Like having him to bounce our ideas off of and calibrate one another, like what could be a good business opportunity and like what's clinically valid and safer and better than the standard of care, and balancing those things. And his day to day, really, it's like it's a mix of building up our clinical protocols and guidelines, training our medical team and screening them when we hire them, supervising them day to day, managing like escalations that come up from more complicated cases, and then also identifying new treatment opportunities. There's actually like quite a number of exciting new verticals that in dermatology that we're starting to explore that originated from his brain space.
Yeah, well, and this is something I see a lot with healthcare startups in particular, and it makes sense, right? The stakes are very high, even in dermatology. And so I know like Function Health, for example, has a connection to Peter Attia, and you sort of need a medical expert or a chief medical officer who understands the ins and outs of how the system works and how to provide reliable care. And then you need the business side. And given your experience at Wharton and at Penn and studying business specifically as it applies to healthcare, it makes sense. You guys are a good team. So let's jump into this origin story behind Honeydew. And you've already talked a little bit about how you were personally struggling with acne. You lived in New York, where there are more dermatologists than any other state in the country. You couldn't even get access to Dr. Spitz yourself, your co-founder. And so you ultimately sit down and decide you're going to start this company together. I guess what made you decide you all could succeed in a space where multiple other companies have tried but ultimately failed to really achieve any meaningful scale?
First of all, I don't know if I'd say that companies have failed to achieve meaningful scale. I think there's actually quite a few players in the more like commoditized like parts of telederm that exist today that are doing well into 9 figures in revenue. And so I think there's a number of companies that we can point to as like doing pretty well at scale. But the reason that we started Honeydew, even when these other companies existed and thought that there's a high chance of success, is really started from just me as a patient.
Mm-hmm.
Um, and these companies were not an option for me. Like they didn't offer what I actually needed. And so that's kind of what started the whole thing. And then as I dug into like what's actually out there in the market, it just kind of got more validated that like a lot of the telehealth space more broadly, but in particular in dermatology, like companies that got really big have been really focused on these simple commoditized treatments. Like in the case of dermatology, it's a topical cream. In the case of some other players, it might be like ED pills or hair loss pills, things that are like super commoditized, generic. Like you could buy them for $5. They put a brand on them, sell them for $50 a month and make money on the recurring purchase. But that might not be in dermatology like what I needed. Like that custom cream was not going to help me with the level of acne that I had. I needed like full strength FDA topicals, oral medication, ultimately like am on Accutane now and have been on it, and like I'm so grateful that I went on it. But like you can't get that from any of the players that were in the market, and so that's where I really felt like we have an opportunity here, because we're focused on getting people the treatments that actually work, even though they're way harder to prescribe, and we can get into why. Versus like what makes a really good business model, which is like, oh, I could just make like recurring revenue on this really simple product that I brand, and there's no operational like lift to do there.
So let's get into the why. And I know this relates to your core product thesis and maybe how it was differentiated from some of these other companies that had previously existed in telederm. So you, in many ways, you started with the hardest part of the problem, right? You started with the patients who really had acute acne or skincare needs that weren't easily addressed by stuff that they could access off the shelf or from other services. What do you think were the pros and cons of that approach, and how have you been able to overcome some of the challenges, specifically with just getting past some of the regulatory hurdles with Accutane in particular as a treatment for acne?
The cons are obviously just like operational complexity, but I think the pros greatly outweigh the cons, and that's why we're building in this model. More importantly than anything, like we're just getting people better. Like we're actually getting them treatment that works, and that makes all the difference in customer satisfaction. It reflects in our business growth and outcomes, but it also just like from my personal mission of why I started this company, like this feels like the right thing to be doing. The reason that like some of these treatments are so hard, like let's talk about Accutane for a second. It's for context, for listeners who might not know, it's an acne medication that's just like completely life changing. Like when nothing else works, Accutane works. It's really a godsend. The problem is it's almost impossible to get, because as hard as it is to get into a dermatologist's office with the 3 to 6 month wait that you'll have, it's that much harder to find one who will offer Accutane. And there's really two reasons for that. The first is that it's a regulated medication through what's called an FDA REMS program, which exists to mitigate risk. In this case, the risk is that you can't take the medication during pregnancy, because it can endanger the baby if taken during a pregnancy. And the government has taken a really strict approach to preventing that from happening. So there's like this government registry program, essentially, where every person who comes in contact with this medication, every doctor, every patient, and every pharmacist has to be registered on this government website. And every single month, for every single patient, they have to complete tasks on this government website that are time sensitive. There are different tasks and rules about the tasks for different types of patients and where they are in their treatment course. It's super convoluted and confusing. Nobody's really been able to manage this at scale, and nobody wants to deal with it. Not the doctors, nor the patients who have to come in every 30 days to the doctor's office, because you can only issue a 30-day supply at a time. Honeydew has obviously played a big role in simplifying that by taking a lot of that online and also building a lot of workflow tools to make complying with these regulations at scale feasible. And then the second thing is there's really a lot of misconception around Accutane. Like historically, it's been considered this last resort medication. And that derives from rumors that we had 20 to 40 years ago when there was concerns about potential side effects and even lawsuits about these side effects. That, by the way, Roche lost back then. They've since been overturned, but we now have 40 years of research on this medication. It's not a new medicine. Like we know very clearly what side effects it has and if and how to manage those side effects. And also what side effects it doesn't have. And a lot of side effects that people used to think it had have been debunked. In particular, like one of the most interesting things that we've learned in the last 40 years is that it's the medication is actually just as effective at low doses as it is at higher doses. And so you can actually give people a much better experience on this medication and reach the same results with a lower dose course of therapy. And so we have, we just have a different perspective at Honeydew. Like you don't need to try and fail 15 different things and go through this 10-year journey like I did to get better, because you're either a candidate for regular dose Accutane based on the severity of your acne, or you're a candidate for low dose Accutane if you have very stubborn acne and you don't want to try topicals or orals, and that's okay as long as you're aware of everything that goes into it. And so that's why historically it's been so hard, but we've really been doing a lot to like change the prescribing pattern there.
Yeah. Well, and it's so funny because I think with many medications, you hear the opposite, which is doctors are just handing these medications out like candy, not because they're malicious about it, but the way our medical system is structured, they're incentivized to do so in many ways. But in the case of Accutane, it's on the other end of that spectrum where, for a variety of reasons, it sounded like, one, it was just being prescribed at doses that were maybe higher than it needed to be prescribed, which was leading to unnecessary side effects. But then two, there were some misconceptions around how dangerous it actually was, so long as you're not pregnant. And so the government got involved and put up so much red tape that the cure was worse than the disease, right? They were protecting people for good reasons, but then the number of people who can get access to a potentially life-changing treatment were suffering as a result. And I've had plenty of friends who've taken Accutane and have had similar results to yourself, right? It really changed their life. So let's get into what I love about this episode is so many of the companies I talk to in consumer subscription, they're digital only apps, they're selling great products and services, but they're pretty simple, pretty easy to replicate. Honeydew is a service that is really, really hard to build. And what that means is getting it off the ground may be difficult, but if you can really get it to work, then there's real competitive advantages that you can build on over time. So let's talk about some of the operational complexities you had to solve. And first, let's just start with breadth, right? You started in, I believe it was one state, and then you announced last year you're in all 50 states nationally. What did that process look like, and what were the steps to get there?
That was like one of the worst parts of starting this business. And honestly, something I was really naive about, because I thought like, oh, I'm an online company, like we could serve the whole country. And then I had to realize like actually having a national company is more like having 50 smaller companies with all the different state laws that exist. And in particular with medical licensing, where it's supply constrained, like there's not enough doctors. And part of that is kind of like on purpose. The medical boards are limiting the amount of licenses that they give out. And so it's like, it's pretty hard to get people licensed. Like there's all sorts of roadblocks. I remember when we were trying to get my co-founder license in Texas, after like taking 6 months to review the application, they rejected it because they wanted more information. They wanted a letter from the dean of his medical school about why he took a gap year 30 years ago.
Wow.
The dean is no longer with us, so we could not secure this letter.
Oh, no.
So it was a process. I'm proud to say my co-founder is now a 51 state licensed derm, the 51st state being like DC. And yeah, I mean, it really was just a lot of like grit going after the state medical boards, following up, getting them the information. My co-founder got fingerprinted like 1 million times for all the applications. And now we can finally do what we set out to do, which is like remove geographic barriers to care. And you could be in Wisconsin and see a dermatologist in New York as long as that dermatologist is licensed in Wisconsin.
So I can guess, but what are some of the implications of 50 states? I mean, I have to believe the whole is greater than the sum of its parts to a degree. What has it unlocked for you being nationwide?
Hugely. Yeah, we actually started, our initial strategy was like, let's go state by state and really figure this out. And we were in New York for 6 full months, just New York, trying to do that, and doing crazy things that I probably will never do again. Like we rented a booth in a mall, and I went 9 to 6 p.m. every single day, 9 a.m. to 6 p.m. for a full month to the mall to like stand by a booth and see if I could like get people in the state to sign up. I think we got a total of 0 signups the entire month.
Oh, no.
And I had like this huge poster of me with like covered in acne saying like, this was me trying to like catch attention. And total flop. But it was really like acquisition was really expensive. And then we were like, let's try one other state. And we added Florida, and our business doubled overnight. And I'm like, there's something interesting here. And we shifted strategies to get as many states as possible, as quickly as possible. And it's really been transformational for the business. To your point about like the sum of the whole is greater than the individual parts. There's just more people to target with marketing and to reach, and there's compounding effects of that because you give more data to the ad platforms to like find the right types of people, and word of mouth compounds faster, and it just like really sets things in motion.
Yeah, that makes a lot of sense. And we're going to talk about acquisition strategy in a little bit. But one other question I want to ask on the product side is, you're a business that depends on human beings. There's both the dermatologists themselves as well as the care team around the dermatologist that supports your patients. And you have physical products. And so there's a lot of complexity relative to your typical consumer subscription app. What implications has that had on your ability to scale?
Yeah. Thankfully, we have great partners to support on the physical product side of things. And so we haven't had to take too much of like the operational burden of managing that end of it. On the human physical, there's a human physical element to this too, which is like the supply of medical providers. That's really complicated. And remember, we're coming in inherently with like a supply constrained market. There's just simply not enough. dermatologists in the country, and that gap is widening, not closing. So a huge part of our ability to scale and do what we're doing is like better leveraging every individual dermatologist, properly empowering them with extenders like derm nurse practitioners and derm physician assistants. Balancing that's really challenging because you have fluctuations day to day, but hiring is not a day-to-day decision. It's a long-term decision. And so even though at a micro level, we don't really feel the supply constraint because we have like a long wait list of providers interested in working for Honeydew, there's still like onboarding, training, and time, that licensing time that goes into getting them up and running. But the consumer can't wait that long. So like if you don't have enough providers on staff, and we've struggled with this, like you can go very quickly from same day, next day availability. Within a day, you can go to you don't have appointments for a full month. And then customers are unhappy, you're losing revenue. But you don't want to overcorrect for that because then you have providers that don't have enough caseload and then they're unhappy. You're going to churn and you're going to lose them. And you don't want to lose them. They're hard to come by. So that's a really complicated problem. And I think it'll be a challenge for us along every step of our journey as we scale. But I'm proud to say that for the last 8 weeks in a row, we have been able to offer same day, next day availability to over 90% of the country. And we've gotten much better at it thanks to like some product work we did. Licensing work, we're getting a lot more people licensed a lot faster now. Because that means instead of moving parts instead of dealing with 50 different equations because they can only operate in one state, we can like just deal with one equation for the whole country.
That's great.
Yeah. And we've gotten better at forecasting as well.
Yeah, I mean, on top of the human component and the physical product component, it really is a two-sided marketplace. And especially in a category where the doctors are already supply constrained because of the licensing challenges that you talked about, it really is a complex dynamic to manage marketplace liquidity. So one other thing on product before we get to acquisition and growth strategy, partnerships have been really important to your growth. And as I understand it, you're now the lowest cost provider in the nation for many of the medications that you sell.
Yeah.
What have some of these partnerships looked like, and how have you been able to get such compelling partnerships so early in the company's journey as a small startup?
That's one of the benefits of having a niche focus, and why for every entrepreneur, honestly, I recommend always starting niche. Like obviously there needs to be a big TAM that you ultimately go after, but it's so much better to start niche and have focused acquisition, product, etc. strategy. But it also really benefited us here in terms of partnerships because it wasn't that hard for us to get strong market leverage, because our competition is these traditional brick and mortar derm offices that, let's say in the case of Accutane, maybe they're seeing 50 Accutane patients a month. That's not hard to compete with in terms of like market share. So like for us across all 50 states to treat even a few thousand people a month on Accutane, we're already the largest player and have like negotiating power with potential partners to say like, make us your exclusive online provider. There's no opportunity cost there because there's no one else for them to turn to, and no derm office is competing with our volume, no individual derm office. So we got negotiating leverage pretty early on to like set up these exclusive distribution deals. And so that really has made a big difference because there's a lot of issues getting patients medications covered by insurance. That's like part of the frustrations. Like you could wait 6 months to see the dermatologist, and then you go to CVS and they're like, this tube of cream is $600. And you're like, WTF? It's so frustrating. And as a result, over a third of prescriptions are never even picked up from the pharmacy that get sent out for derm conditions.
Because the price tag ends up being so high that people can't afford it.
Usually the price tag is the reason for it. And so it's so nice for us to say, if you can't get it to you for like $0 through insurance, we actually have a really amazing cash price that we can get it to you for. And it's been game changing. And our prices are so good, like they're better by a pretty significant margin than even the prices you'd get from a GoodRx coupon. And that's, thanks to these partnerships that we've been able to set up.
Well, I imagine part of this too is a lot of your customers are teenagers, right? Certainly not all. You've got plenty of adult customers, but teenagers by and large don't have a lot of disposable income. And so if their parents can afford this medication, great. But if not, then every little bit that you can lower costs goes a long way.
The other thing we learned, by the way, is like, especially for college age students, not everybody really gets how insurance works. So like often we see like people think like, oh, mom and dad have insurance, it's free. So why would I pay anything? But they don't really get that mom and dad gets a bill at the end of the month with like all the copays, deductibles, and it's actually not free. Healthcare insurance is so expensive.
Oh, yeah. Yeah. Well, and as a business owner myself, it's even worse. If you own your own business and you're not employed,
Yeah.
somebody needs to solve that problem, and I'll have them on my podcast. Well, let's get to growth. So we've talked about your personal journey and why solving this problem around acne and other skincare issues was so important to you personally. And we talked about how the product and service is a complex one, and the operational challenges you needed to overcome to really get to the beginnings of escape velocity. Now we'll talk about growth. And so to start with, a very simple question: to what degree is Honeydew currently relying on paid versus organic acquisition channels to scale?
We are still relying on paid channels to a fair extent, but it's like probably a 70-30 split right now. And our organic presence is really starting to grow, actually. It's just not something that we've spent a lot of time heavily investing in. Like, we were very conscious when we started the business that because of how operationally complex our business is, that we need to invest in the product and technology behind it. We need to invest in the supply partnerships and operational backend before we really distracted ourselves too much with marketing, because that potential is not going away. And thankfully, there were like some really great channels that we can control spend through, and we like gained efficiency pretty quickly through. And they're continuing to scale really well. And honestly, I think like we're nowhere near tapping out the potential of these channels. And these channels like Meta and like Google, they reach so many people. I think like it's often underestimated, like underappreciated how many people they actually reach. And I know it's like easy to be scared of paid channels because there's like a lot of graveyard, there's a big graveyard of companies that were too reliant on them and flop. But there's also a lot of companies that have really succeeded scaling on paid channels.
Well, and I would think you have two very specific advantages when it comes to pain. One is you are solving, it's the definition of a painkiller, right? There's physical pain and emotional pain caused by acne. And so this isn't something where you're spending $50 to acquire a subscriber who then maybe churns after 1 month because they don't really need your product.
That's right.
And the second thing is, I would imagine on Google in particular, there are a lot of search queries that you can pay for particular keywords that are highly relevant to targeting your customer. And then on Meta, there are probably demographic variables that are correlated with your target patient. So which particular channels have been most effective for you? You've already talked about Meta and Google, but are there any others, longer tail channels, that have been surprisingly important for Honeydew?
Yeah. And I mean, by the way, on Meta, Google, like we were like exclusively Google for quite a while, and Google is still our largest channel today and scaling pretty well, which people often like are surprised by because usually that answer is Meta. We only launched Meta like 6 months ago, and it's scaling pretty well, and maybe it'll become our biggest channel down the line. But Google's actually like there's a big opportunity on Google for us for exactly the reason you said, which is like they're great keywords that are like really not competitive and high search volumes for them. Other channels that have been interesting for us. One interesting one is Reddit, honestly. Like I spend a lot of time actually like on the Accutane subreddit, answering questions, engaging with content. And I've had a lot of fun on that, and we've definitely gotten customers from that. We're doing some work with TikTok now that's kind of interesting. Again, derm is like such a visual thing. Like you can really see the impact of the medicine, and it's usually highly engaged content, particularly if you're talking about something controversial like Accutane. So we're seeing some early success there, and have some good lessons learned there too. And we're doing TikTok both on from the organic sense, working with micro influencers, but also from a paid perspective, leveraging those videos that they create to then actually run ads.
Well, and it doesn't surprise me that you say you've done well on both Google and Reddit. I've found, I don't have a huge amount of data on this, but anecdotally, I find that a lot of our clients that are successful on Google also end up being successful on Reddit. Because when you think about it, with Google, it's a set of keywords that are sort of creating a center of gravity around which target customers coalesce.
Yeah.
And then with Reddit, it's the same thing. It's just around forums or subreddits where people are congregating and talking about very specific problems. And so if you have a product that is highly specific to a particular use case, then both of those channels tend to be pretty effective. Let's switch gears and talk about TikTok and YouTube and these influencers, because I'd imagine you have a lot of your audience is teenagers. We were talking about that earlier. So you have a largely Gen Z audience, and you have a product that is serving a condition that is highly visual. And so I would imagine that Honeydew lends itself pretty well to video ads or UGC generated on video platforms. How has that performed for you?
Yeah, like we're earlier in that space, but we've had some like pretty good ROI initially with our experiments, and we're trying to figure out how we scale this now. But yeah, to all the points that you mentioned, like it's going pretty well. Like you don't have to have somebody with a lot of followers. We actually like engaged the largest influencer we worked with had 1 million followers, and we on TikTok, and we reached out to her. And she responded actually like, "Oh, I'm actually a Honeydew customer. I'd love to work with you guys," which was a huge kind of just like exciting moment for
Oh,
me.
that's
That
amazing.
totally coincidentally, this person was actually on Honeydew. But she did a great video, but it didn't perform any differently than videos with micro influencers that we work with that get paid $100, $200 for a video.
Yep.
And so we found really good success in ROI working with like smaller influencers that just have real authentic stories to tell, having them post that, get the organic traction from that, and then boost those with Spark ads or like use clips of that as part of like content that we make for Meta and for TikTok. We had pretty good success with that early on, and now we're trying to think through the question of like, how do we pick up the volume of that?
Yep. Well, and what you're saying there is something I've heard consistently across the board and something we've seen with our own clients, which is typically, even if you have somebody who's perfect for your product, who has a huge following, so much of TikTok in particular is just a numbers game because of the way the algorithm works and how much of it is just serendipity and hitting the right message at the right time that strikes a nerve. And so what I'm seeing more and more companies do is aggregate portfolios of dozens or even hundreds of micro influencers, pay them $100 or $200 a pop, or even pay them on a performance basis so that there's no flat fee at all. It's entirely performance driven. And then a lot of them are going to be duds. But as long as you get a few outliers, then that can end up making up for all the rest. And in the aggregate, it performs better than paying 3 or 4 influencers a ton of money to go try to sell your message.
Exactly. One video hitting can make up for like a bunch of failed videos.
I'm curious, as long as we're on this topic, are there any particular tools that you all are using to scale UGC content and advertising, whether those be tools to identify the right content that's going to perform the best and or AI tools that just allow you to create more of this content at scale?
We have definitely experimented with a bunch of things, including like generative content tools, but usually for non-human, like ads that don't involve humans, like we're very conscious about using like real people in any of our visual and video ads, to stay true. I mean, because it is a healthcare service, and we want to be like really true to like having real patients and like people who've really used the medicine talking about it. So we've not unlocked like AI patients at the moment, but we've used tools to like help manage the content and do the contracting work and such. Like we use Upfluence right now. We're testing that tool as like a creator engagement platform. We're also doing just like a lot of DMing and just like, nothing really as good as just like rolling up your sleeves. And my For You page, by the way, now it just like does it for me. It's like all people on Accutane. So just scrolling through and directly messaging them.
Yeah, this again is pretty consistent with what I've heard elsewhere, that there are more and more promising tools that are simplifying some of this process, whether it's identifying the right creators, identifying the right trends to create content around, or even using VO3 to create entirely AI generated ads. But especially for a service like yours, where so much of it comes down to trust and safety, I would imagine AI generated content is particularly tenuous because it could really undermine the trust that you're trying to build with your patients. So we've talked about acquisition channels. Let's talk about onboarding, because especially with a high touch product like this, where the consequences are significant, I would imagine that just getting users from a channel like Meta or TikTok or Reddit or Google to your product is just the beginning. Then you have to convince them to actually connect with a doctor, invest in a care team, put down money for a subscription. What has the onboarding flow looked like, and how has it iterated over time to make sure that you're connecting these patients to your value promise as quickly and effectively as possible?
Yeah. And by the way, it's different for different channels too. Like somebody coming in from Google has a very different like commitment to buying and like willingness to go through a certain onboarding flow than somebody coming from Meta, for example. And that was like a learning for us because we started exclusively on Google, and we had these like very bottom of funnel customers coming in, and it was a very different experience when we started advertising to Meta, and like people were seeing ads who like weren't necessarily searching actively for what we're offering. And so there's that thing to that's a consideration to have too. But we've like really just anchored to trying to provide value as fast as possible. And one thing that we've done in this regard that I really don't know a single other company in our space that's done this. And when I talk to other founders in like the telehealth industry, they're like, "What?" Is we don't ask for the credit card up front when we put it in front of a doctor. You can actually get on a video call with our doctors without ever putting in your credit card information for your initial visit. And that was a decision we made early on when we didn't have any real traction, as a decision to prioritize volume and data like learnings over noise reduction. And we like really haven't changed that decision since, and it's been 3.5 years. That may change over time because there is noise that comes through, like there's no shows and things to deal with as a result of not requiring a credit card. But yeah, we've really as a company just anchored to like, listen, like this is a high consideration product. We'll get you in front of a doctor. You see if this is right for you, and then you can make a decision or not if you sign up. And if you sign up, we know you're going to be getting treated for quite some time. So like we'll make it up on the back end, and that's okay because we know we can deliver that value.
Some of the best consumer subscription products out there that I know of use what they call a reverse trial model, which is essentially what you're describing, right? You get access to the premium version of the product without having to put a credit card or other payment method down up front. Now, in your case, it's a little different because there's still an intake flow and you're meeting a doctor and you're making sure it's a good fit. But the through line is companies that are really confident in their core product and their value promise and their ability to convert and retain subscribers can do this and trust that it's all going to work out on the back end. And I would imagine another big advantage is much lower subscriber churn rates, much lower refund and dispute rates, all of which leads to a healthier long-term business model.
Yep.
A couple more questions before we get to our lightning round. So now that you all have the beginnings of real momentum, how do you expect your growth levers to change over the next few years as the company scales? And you've already gotten through many operational hurdles, but what are some of the next ones that you expect to need to clear?
I think that aside from obviously just like winning more market shares and building, to become the brand in the space that we're in, which is the most important thing, like the things that are on the roadmap for us in terms of growth vectors are, first of all, integrating the experience end to end. We've really focused on the access and expertise part of the equation, but then you still have to get your lab work done and get your medication. And there are friction points that happen there, actually a lot of friction points, and integrating that to all be under the Honeydew umbrella where we manage the whole checkout experience. It's a growth vector for us. It's a better patient experience for the customer. So that's one. Another one is serving those customers deeper. So this is part of like transitioning them from, hey, you came for this specific skin issue and we're going to get it cleared, to what's like our broader vision, which is to be their skincare partner for life. So now that we've cleared your acne with Accutane, what does your post-Accutane maintenance routine look like to prevent relapse and then work on other things you might be concerned about, like your skin's longevity and wrinkles, or pigmentation or scarring you have after acne, or the texture and coloration of it. And working on that with them. We're running some experiments on that now and seeing some good early results. And then the third thing is replicating this kind of experience and funnel we have for acne with other condition types, like eczema and psoriasis, hidradenitis suppurativa, some others. And we've already gotten some early market validation that we can acquire patients here. We have hundreds of patients in each of these condition groups, like collecting new cohort data for us. But we've not built a product experience for them. And I think like in terms of this ties into your question of like operationally, like what's next and challenging for us. And I think figuring out pricing and packaging is going to be a core part of that, because what we're learning is different users need different types of pricing. Even within acne, an Accutane patient is not the same as a patient on a custom topical. And an acne patient is definitely not the same as somebody like on an injectable biologic you take once every 3 months. And it doesn't make sense for someone taking a medication once every 3 months to be paying a monthly plan. So we really need to get pricing and packaging right. And it sounds a lot easier than it is because there's so many edge cases, considerations. People have multiple conditions that we're treating. And so that's going to be a big focus for me in the next 6 months.
Yeah, well, and that last point you made around expanding beyond acne and Accutane treatments into all these other skin conditions goes back to your original point, which is why it's so powerful to start in one niche. But then once you've really earned the respect of your target customer, that it unlocks all sorts of additional opportunities if you're in the right market. And I think some of the most valuable consumer subscription apps out there followed a similar trajectory. You've got Strava that started in cycling and then
Yeah.
expanded to running, and now all these other outdoor activities. You've got Duolingo that spent over a decade exclusively on language learning, but now they're doing math, they're doing reading and writing, they're doing science, they're doing chess, right? And so if you're really good at one thing, then more often than not, it will lead to opportunities to expand into other things. But you gotta start somewhere. Last question before our lightning round. So how do you think AI will factor into the service that you're building at Honeydew?
Yeah, we'd be remiss if we didn't mention the word AI at least
I know.
once.
I got to do it. I do it on almost every episode. People are probably getting tired of it, but everybody's talking about AI right now. So we got
No,
to
you have to. I mean, yeah, to me, it's kind of like asking how you use AI is kind of like saying like how you use software. Like it's like you can't not really use it. For us, there's three areas I see like it really playing a pivotal role. And the first is in empowering people. Like fundamentally, there's a huge gatekeeping problem. There's a very small supply of experts that have knowledge, and it's really hard to get to those experts, and they're really expensive, and there's a gatekeeping problem. And AI is really a huge opportunity to solve that gatekeeping problem. And part of our vision is to really make it free for people to get clinically backed guidance through interactions like an AI, like a clinically trained chatbot, or like even an AI face scanner where you get your skin scores and some product recommendations personalized to those skin scores. And then you can funnel to a consult with a dermatologist if and when it's relevant, but not in every single case. And so that's one. Another one is diagnostic and clinical decision support. So this is on the back end. And for something like acne, it's probably not that exciting because it's pretty easy to diagnose acne. But as you get into more specialized conditions, even parts of eczema and psoriasis, but there's also others that are even more complicated to diagnose in dermatology, not every provider is made equal. And that means the already small supply of providers is actually even smaller because only a few of them are specialized. And visual diagnostics that can provide like a reliable and accurate differential really solves that problem because you can now empower providers to do more and like maintain a certain level of quality. So that I'm really excited about. Our perspective on that is that we're not going to be the ones that build that tool. There's a lot of people trying to build that tool and working on it successfully. And I think that's going to be more or less kind of commoditized and something we plug into our service and not something we have to build from scratch. And then the third is operational unlocks. And this is like in 2023, like a whole bunch of all the VCs were saying like health tech enabled services, like these are non-investable businesses. And I didn't believe that then, but I definitely think that this isn't true anymore now with the advent of AI. There's just so many cool operational efficiencies you can gain using technologies. And I'll just give you one example, which is when patients send us chat messages, they don't the care team doesn't know what the message is until they read it. And so we don't know who it needs to go to, how urgent it is. But an LLM can read that message and properly route it to the right person with the right urgency, made very clear from the start. And that allows us to offer a much better service. And those kinds of things on the margins like make all the difference in like what the customer experience is like and how scalable the business is.
Yeah, I love that. Well, and I had another guest on the podcast a couple months ago from Superpower, which is creating a platform for basically holistic healthcare, starting with labs and then kind of figuring out, more in-depth health problems to solve based off of your unique stats. And so that's an instance where the bet is that over the long run, AI can actually improve the quality of healthcare diagnostics and care to the same level or better than a doctor. But I think in the short term, some of the biggest opportunities are just around reducing cost and complexity. And so what I hear you saying is, we talked earlier around how access to these medications is difficult, both because you just can't get in front of a doctor or in some cases because it's so expensive. And so every bit of cost that you can strip out of the system means potential savings you can pass along to the customer, which is really powerful in a market like this. Well, let's jump to our lightning round. So I'll ask you a few rapid fire questions and we'll just keep the answers relatively short and fun here. The first one is the same question I always ask at the beginning of our lightning round, which is, what would you say the best part about working at Honeydew is, and what's one thing you would change?
Yeah, the best part is definitely the patient reviews and stories that we hear. They're so inspiring and motivating, and it makes every tough day worth it. These are really emotional conditions that we're treating. And then the thing I change is the laws that we have to follow. There are so many roadblocks, and they're very expensive to deal with in healthcare to like drive innovation. And so a lot of laws I would change.
Yeah, I'm sure there are a lot of healthcare startups that would say the same thing. What do you think is the biggest misconception most people have about Accutane? We talked a little bit about this earlier, but anything more you want to say on that?
Yeah, just that the fact that it's a last resort that will destroy you is like a total misconception. It can be managed very safely, and you can have a smoother course even at a lower dose and save the years of suffering.
Yeah, well, and I think it's also one of these things where, I mean, even now, right? It's probably not that there's zero risk to taking Accutane. There's
For
risk to
sure.
taking almost any medication, but what people
Absolutely.
don't talk about enough are the consequences of acne going untreated. And there's the physical pain and discomfort, but there's also the mental and emotional damage it can do to somebody over years and years. And so, at some point, you've got to weigh the cost versus the benefits, and the benefits are very clear.
Huge. And there was actually a study that came out evaluating things like psychiatric distress, and that actually concluded it was a meta-analysis of over 1 million patients and found that people who finished Accutane were statistically significantly less likely to commit suicide
Hmm.
than patients who did other forms of treatment or no treatment at all. So 100%. And other medications have side effects too. Like the standard of care for acne care is like chronic prescribing of antibiotics, which totally destroys your gut. Nobody talks about that either. So, yeah.
Yeah. Yeah, that's a great point. Okay, a few more here. What is the most inspiring story you've heard recently from a Honeydew patient?
We recently did a grand rounds with all of our clinicians, and a clinician presented this, and I really was moving. But it was a story about a 12-year-old boy who had such a bad breakout of acne that he literally left school and started getting homeschooled because he was so embarrassed to go to class. And his skin is looking so good now. Like I cannot like it's truly acne is truly a miracle drug. Like the disparity between the before and after photos are incredible, and so yeah, just really moving to see progress in situations like that.
Yeah, I'm gonna have to check in with you in a couple of years and see how that story progresses because I can only imagine what an inflection point that is in a teenager's life.
Yeah.
Um, After acne, what's the next skin condition you're most excited for Honeydew to tackle?
I'm going to cop out and give you two, which is eczema and psoriasis. And the reason I say two is because like we don't have enough data to really like pick one just yet. We're
Mhm.
doing experiments with both right now, um, and the motions are pretty similar for both. But there's just for the first time ever, unlike Accutane, which has been in the market for 40 years and just completely slept on, there's never been good treatments for eczema and psoriasis. It's just been like throw a topical steroid at it and like deal with the symptoms and good luck. And now we have like really amazing treatments. There's a huge boom in drug innovation in these for these conditions, and it's the same problem. People just can't get them. So I just feel like we're really well positioned to solve that problem for these more complex meds because we've done it with Accutane.
Yeah, it makes a ton of sense. And by starting with one of the hardest problems, it should just get a little bit easier from here. So, last question, I'll go with a variant on it. We talked already about how AI is impacting Honeydew today, primarily as it relates to lowering costs and removing unnecessary complexity. At what point do you think AI will start to be able to improve the quality of the care that you offer, specifically as it relates to like diagnosing the right treatment for a particular skin
Yep.
condition? And what timeline do you think it's going to take to get there?
And my answer to this might surprise you, but I actually think this is happening today.
Hmm.
This isn't something that's tomorrow, 3 years, 5 years, or 10 years from now. This is really happening today. It's really like the first time ever that healthcare is like not lagging behind in technology adoption. And you see that through things like open evidence, doing like their medical test scoring and succeeding. There's a ton of visual diagnostic tools in the case of dermatology that like have great accuracy with diagnosing medical conditions. Um, and so this is happening today. Um, and the impact is happening today. The adoption of that will grow over time, but the tools exist today, and the adoption of those tools is already happening today.
That's really exciting to hear. Well, it's been such a pleasure having you on, David. And this was a particularly heartwarming episode, given the mission of your company and how many people's lives it's touching. Anything else you want to leave our audience with before we wrap up?
I guess I just to reiterate like the importance of pricing market fit as much as product market fit. I mentioned that that's like going to be a focus for us in the next 6 months, but I just don't think people talk about it enough. Everyone always talks about product market fit, but pricing market fit is so game changing if you get it right in a business. And shout out to like some work that we've done together, working through some of the pricing and packaging. Really excited to get that stuff into production and testing it.
Well, you're certainly preaching to the choir. I couldn't agree more. I think pricing is one of the most overlooked levers for a lot of startups. But that's exciting to hear. And especially because the more efficient you guys can get on price, hopefully the more you can pass along some of that efficiency to your customers over time. Thanks,
Yep.
David. This has been a real pleasure.
Yeah. Thanks, Phil.